2013, 805,500 women were diagnosed with cancer. Of that number, 3% of women were diagnosed with ovarian cancer. The risk of ovarian cancer increases with age, with the most common form of ovarian cancer being diagnosed between 50 and 75 years old. Half of all ovarian cancers are diagnosed over the age of 63. For those with no family history or symptoms, there is still a 1 in 70 chance of being diagnosed with ovarian cancer. There are no explicit symptoms for ovarian cancer because the symptoms mimic those of gastrointestinal complications. There are no definitive screening tests, but a combination of multiple tests can give a better idea of the presence of ovarian cancer. Possible treatments include surgery, radiation, and chemotherapy. Birth control, breastfeeding, healthy eating, exercising, and childbearing can all decrease the risk of ovarian cancer. September is Ovarian Cancer Awareness Month.
Symptoms of ovarian cancer are not specific to the disease, and they often mimic those of many other, more common conditions, including digestive problems. Signs and symptoms of ovarian cancer may include abdominal pressure, fullness, swelling or bloating, pelvic discomfort or pain, persistent indigestion, gas or nausea, changes in bowel habits such as constipation, changes in bladder habits, including a frequent need to urinate, loss of appetite or feeling full, increased abdominal girth or clothes fitting tighter around your waist, a persistent lack of energy, or low back pain.
I think women are so used to feeling bloating that it's a hard thing to recognize as a symptom that's out of the ordinary.
There is no routine screening to test for ovarian cancer. Screenings have not been proven to decrease the death rate from the disease. However, there are some screenings that are under study with clinical trials currently taking place. The screenings that are taking place are the pelvic exam, transvaginal ultrasound, and the CA-125 assay. A pelvic exam consists of a doctor or a nurse inserting 1 or 2 lubricated, gloved fingers of one hand into the vagina and pressing on the lower abdomen with the other hand. This is done to feel the size, shape, and position of the uterus and ovaries. The vagina, cervix, fallopian tubes, and the rectum are also checked. If ovarian cancer is found with a pelvic exam, the cancer is usually pretty advanced. The transvaginal ultrasound is when an ultrasound probe connected to a computer is inserted into the vagina and is gently moved to show different organs. The probe bounces sound waves off internal organs and tissues to make echoes that form a sonogram. A CA-125 assay is a test that measures the level of CA-125 in the blood. CA-125 is a substance released by cells in the bloodstream. An increased CA-125 level is sometimes a sign of certain types of cancer, including ovarian cancer or other conditions. Scientists at the National Cancer Institute studied the combination of using TVU and CA-125 levels as a way to screen for and prevent death from ovarian cancer. The results of this study showed no decrease in death from ovarian cancer.
I remember even a couple of years before being diagnosed with cancer, being very curious about the CA-125 test, and I didn't really understand until recently that if you've had cancer, it's a really good test to have, but it's not a useful screening test for the mass population.
A gynecologic oncologist is who performs the surgery on ovarian cancer patient. Due to different stages of the disease depends on the type of treatments the patient will receive. Stage 1, ovarian cancer, is a total abdominal hysterectomy, removal of both ovaries and fallopian tubes, omentectomy, biopsy of lymph nodes and other tissues in the pelvis and abdomen. A younger woman with only one ovary affected is often treated by a unilateral salpingo oophorectomy, which is removal of the affected ovary and fallopian tube without hysterectomy. If tumor is high grade, the patient may receive a combination chemotherapy. Stage 2, almost always a hysterectomy and bilateral salpingo oophorectomy, as well as debulking of as much of the tumor as possible, and sampling lymph nodes and other tissues in the pelvis and abdomen. After surgery, one of the following treatments will occur. Stage 3 is exactly the same as Stage 2. Stage 4, you will have surgery to remove as much of the tumor as possible and followed by combination chemotherapy.
Lean on me.